Hello, my name is Melinda Frost, and I work for the World Health Organization's Health Emergencies Program. I'm going to talk about risk communication and how it can be applied for emerging respiratory viruses. The learning objectives for this section are that by the end of this, you should be able to describe key risk communications concerns for emerging respiratory viruses, list at least 3 barriers for effective uptake of health advice, and identify some key interventions for operationalizing risk communication during an outbreak or an event. There's several unique factors when it comes to risk communications during an emerging respiratory event. Things that remain typically common are that people need to have good respiratory hygiene and good hand hygiene. Sometimes we're really worried about human-to-human exposure of a respiratory virus. Most of the time we are. And sometimes food exposures can come into play. What we're thinking about when we think about human-to-human transmission is that we're talking about droplet precaution. And that's when somebody coughs or sneezes and fluid comes out a little bit, and that may, cause somebody else near you or near a person that's infected to breathe it in, which then spreads the disease. So these are 3 areas that we need to kind of focus on in terms of communication. So the important thing about emergency risk communication is that it's the real-time exchange of information and advice and opinions between experts or officials and people. That means that these things happen very quickly, and you have 2 sort of different groups of people. You have experts or officials, and then you have the affected population. The interesting thing is that during an emergency, these 2 people are almost speaking different languages. Experts and officials are really thinking about it from a scientific or a management perspective, and the people who are affected are really thinking about it from their own personal life. How does this affect me? How does it affect my family? And surrounding this whole thing is this emergency that's going on, this respiratory illness, and it really can affect sort of the social well-being and the economy where these individuals live. So the purpose of risk communication is that people can make informed decisions to mitigate the effects of a public health hazard, such as a disease outbreak. So this is really important. What we need to know is how people think, what their lives are, what sort of decisions are they going to make that can help or hurt during an event. So in emergency risk communications, we often also work with community engagement. You saw the title of this section was called Risk Communication and Community Engagement. And there's several different domains that come into play. It's communication with populations, and it's a lot of social science interventions, really learning about the people. It's a people-centered approach to learn what their lives are like, what they care about, what language they speak, what level they speak it at, what access to healthcare do they have, and so on. And also it includes mass communication, radio, television, print media, and even social media as well. All of this rolls together and then enables us to better communicate in a way that populations can understand and they can adopt the behaviors that we're recommending. So there's several points during an outbreak where communication becomes key. So prior to an emergency, we have anticipation or preparedness. So there's lots that can be done with risk communications prior to there being an event. You would be amazed at how many things that could be already done. Message testing with what you imagine might be affected populations, making sure that you have a coordinated effort. So you're coordinating with potential partners during an outbreak. You're utilizing existing networks. You're training staff to be able to deal with this, and so on. The next step could be early detection of an emergency. And this is a critical time when it comes to risk communication, because that first moment of communicating can really make or break a response. It's really important to get that first message right, and it's really important to be one of the first voices during an emergency. Then throughout the epidemiologic time frame, we see things like containment and mitigation. And communication, emergency communication, is a 2-way loop with the affected population and responders to ensure that communication and messaging is getting to the people that need it in the way they need to hear it. So one of the key concerns when it comes to an emerging respiratory illness is that there could be cross-infection in hospitals that are caring for patients. This is called nosocomial or hospital-acquired transmission. This is when there's human-to-human transmission that's occurring in hospital waiting rooms or potentially in hospital rooms and so on. It's an important area for healthcare workers because they have a lot of work to do to ensure that there's infection prevention and control measures and that they're in place during treatment during an outbreak. That's really important that there's immediate implementation of infection prevention and control measures as soon as there's early identification of patients. And this is a responsibility of healthcare workers. And so that's another target audience that we need to be able to communicate with prior to and during an emerging threat. In some emerging respiratory illnesses, they can be caused by direct close contact with animals or consumption of raw animal products like milk or meat and so on. This is a difficult thing to communicate sometimes because it can be a very cultural situation depending on the population that you're working with. So to communicate that maybe those aren't the healthiest behaviors can be rather difficult to work with in a community. So it takes a lot of engagement with the community to understand where they're coming from and what their information needs and what their behavioral motives are and so on. When it comes to emerging respiratory illnesses, it's important to think about the types of people that may need to hear different messages and have a different reaction in order to mitigate the effects of this emergency. In this case, sometimes it'll be authorities and spokespeople for governmental organizations. Healthcare workers are certainly an important target audience, but they're also an important messenger. Healthcare workers are among the most trusted group of people worldwide. So we both need to communicate with them in order for them to be able to treat and stay safe, but we can also rely on them to be messengers to affected populations. Hospital management personnel, non-governmental organizations and community organizations, influential people, travel and tourism sectors, animal health officials. All of these individuals in some way can be both a messenger, but they're also a target audience. Okay, and when we really talk about target audiences, many times I hear people say, oh, or governments, ministries of health say, oh, we're going to communicate with the general public. Really, we try to think about the fact that you shouldn't just communicate with the general public, that your messaging won't be exact enough to really resonate with your target audience. So we like to, promote the idea that you think about individual segments of a target audience or a general public in a way. So some of these groups may, again, be healthcare workers, patients, their relatives, the community they live in, home caregivers, families and influential groups in the communities. They're often a very good messenger to the communities. Maybe people who are traveling to and from affected countries, and a population that may have animal exposure, veterinarians, farmers, and so on. And then you also have to think about other vulnerable groups, including, maybe migrant workers, depending on the country or the place that you're working with. Many times in communication, we can start off with what we call a message map. And it's a general message that can get to a community that will answer some basic questions. This is an example of one that's meant for, again, the general public. It'll answer the question that maybe everybody has, which is, how can I avoid contracting the virus? And so you see here that there's one key message and then 3 supporting messages under it. So the idea is that the key message is really the one thing that you really want to recommend to your audience to do to help avoid contracting the virus. And then the supporting messages are the things that help support that key message. So this is an example where our key message is frequently clean hands by using alcohol-based hand rub or soap and water. Your supporting messages will have things to do with, well, why do you do that? Well, you need to keep hands clean, and you also want to avoid touching your eyes, your nose, and your mouth with unwashed hands. And when your hands are visibly dirty, this is how you want to wash them. You wash them with soap and water for at least 20 to 30 seconds, or maybe you can hum the happy birthday song from beginning to end twice under running water and wipe your hands dry. And then the third message may be, when hands are not visibly dirty, go ahead and use an alcohol-based hand rub for 20 seconds or wash your hands with soap and water. So these are the types of things that help support or give more information to the key message. Here's another key message that we may use during an emerging respiratory outbreak. This one has to do with cough etiquette. So when coughing and sneezing, cover your mouth and your nose with a flexed elbow or a tissue. Throw the tissue away immediately and then wash your hands. And then you can see below there are some supporting messages that give you just a bit more information, or your audience a bit more information on how you can go about doing that safely. And you can see there's information on, if you don't have a tissue, cough or sneeze in your upper sleeve or your flexed elbow, and then wash your hands immediately after throwing the tissue away. And then you can use an alcohol-based hand rub or soap and water to clean your hands. And then, again, the idea that there could be small droplets that come out of your nose or mouth when you cough or sneeze and can carry germs. So that's just answering the why are we doing all of this? Why is it helping to protect your health? And another example, if you have a fever, cough, and difficulty breathing, seek medical care early and share previous travel history with your care provider. So this is important for audiences to know. And then you have some supporting messages underneath that give you some answers when the public, the media, or whoever asks you, well, why are you recommending that? You want to, provide travel histories in the places you visited, because that may have something to do with where you got the disease from. And then, to inform that you may have had close contact with somebody who was also sick and could have a confirmed infection, which may lead medical providers to better understand that you too might be infected with this respiratory illness. And then inform them maybe if you have visited an animal market or consumed animal products. Again, another hint as to why the target audience may have caught this disease. The most important measure in stopping respiratory outbreaks is to practice proper hand hygiene. And that's simply washing hands with either soap or water or an alcoholic antiseptic for about 20 seconds. You need to do this if you're a healthcare worker, before touching any patients, before any procedures, after you've had contact with bodily fluids, even touching patient surroundings, and before and after wearing PPE, which is personal protective equipment. And then it's important to perform hand hygiene after contact with respiratory secretions and contaminated objects. And that's for healthcare centers, but it's also these processes of washing hands for 20 or 30 seconds, either with an alcoholic-based hand rub or soap and water, are really, really important for just individuals in an emerging respiratory outbreak. Overall, what we're looking for is respiratory etiquette, and that means things like covering your cough or your sneeze with a tissue or your flexed elbow, making sure that if you have a tissue, you throw it away and then wash your hands immediately afterwards. Sometimes if somebody's having respiratory illness, they may be asked to wear a mask. And the reason for this is that we're trying to avoid droplets. If somebody coughs or sneezes, sometimes these droplets are projected and other people can then breathe that in, and then that spreads the virus around. And just always, make sure that there are bins close by so people can throw away tissues, and that there are hand washing facilities nearby, or alcohol-based hand rub is also an important measure. Two very important behaviors during a respiratory outbreak are for individuals to wash hands frequently. We usually recommend with the alcohol-based hand rub because it's very effective if hands are not visibly dirty. If they are visibly dirty, then it's important to wash hands with soap and water. When coughing or sneezing, it's important to cover your mouth with a tissue or your flexed elbow into your sleeve if you don't have a tissue. Then you throw away the tissue and make sure to wash your hands afterward. If you're not feeling well, it's important to see your doctor or healthcare worker if you develop a fever, a severe cough, and it's difficult if you're having difficulty breathing within about 14 days after you're returning from an area that may have had an outbreak of a respiratory illness. It's important to inform your healthcare worker if you've come into close contact with a person that may have had a fever or a cough. When we say close contact, typically what we mean is a family member or somebody you're caring for, maybe somebody that you sat close to for a long period of time that you may have gotten coughed or sneezed on. or even we say close contact could be somebody who's about 1 meter away, but typically we mean sort of a family relationship, people that you're living with and sharing meals with and so on. And it also may happen if you have visited an animal market or consumed animal products. These are important factors that could tell doctors whether or not you've been infected with respiratory illness. One of the important reasons that we use risk communication and community engagement is that we're working with different communities which all have different cultural and traditional practices. These things vary from community to community. And some of the factors that really matter when it comes to taking care of individuals who may have respiratory illness is that healthcare practices may change, and the way that families take care of sick family members may change from community to community. People or communities may have different health-seeking behaviors, or they may have a lack of access to healthcare. Close family contacts, living in close quarters, that's really going to affect how people may or may not get ill. And then there's also a factor about traditional foods and whether or not they're well cooked, which may also lead to further disease spread and so on. A big issue when it comes to risk communication is the trust or lack thereof in authorities. People are always, when they hear information, they're wondering whether or not they can trust the source that the information is coming from. They're asking themselves, is this source credible or reliable? Do I have trust in this person or this individual, the spokesperson or social media that's giving me this information? And do I understand what the information is? Is the guidance consistent across several different channels? Am I hearing the same recommendations on television as I've heard from my doctor, as I've heard from my next door neighbor, as I see on social media? These things of consistent messaging, it really, really matters, particularly when it comes to an emergency. Many times the community may not understand how disease is transmitted. They may have their own beliefs about these things. So understanding what it means when we say human to human transmission, and maybe how people could get a disease from different travel and transportation that they may have done or come into contact with. Maybe that they could have gotten infected at a hospital or a healthcare center, or even just a mass gathering. Why these things are so important when it comes to a respiratory outbreak. And then potentially contact with infected animals or their products. These things matter, and people have to understand that how the risks may come into play with any of these different issues. It's important to understand that different populations are going to have different access to information. People are going to have preferred trusted channels of information. Some individuals may choose to get all of their information on social media. Some may choose to trust their healthcare provider more. So it's really important that you know your audiences and know where they're going to seek information, and that you're using the language that they use, and that they can understand the information that you're giving to them, whether or not it's written or you're using pictures and so on. So it's important to make sure you're using the information sources that people typically use, and then using the language of those individuals as well when you're giving health protection information. It's really important to be first, be fast, and be frequent. That first announcement during an emerging respiratory outbreak is critically important. It's important because that allows the population to know who to listen to, who to trust, and where their further future information is going to come from which authority. Throughout the course of the outbreak, it's important that more awareness about the disease, the situation is constantly updated, particularly among healthcare workers at populations of risk. Things are often changing quite a bit, and that means there's a lot of uncertainty. There are a lot of unknowns. And it's important for public health authorities to explain that uncertainty and say outright, listen, there's a lot we don't know right now, but we're learning. We're trying to find out more, and we will let you know as soon as we know more information. Even when you don't have more information, it's important to update the population on a regular basis with the information that you do have. It's important to be proactive in information too, getting out information through several different channels and resources, again with frequent updates, and always telling the population where they can go get more information. One of the key important things about risk communications is that it is really intended to help people make informed decisions to protect their health and the health and well-being of their family. So this can happen through a couple of different approaches. What we try to do with risk communications is use a mix of tactics and approaches. So it's not just mass media communication. It's not just social media. It's not just spokespeople or leaflets or pamphlets or posters. It's a mix of things. What we're really trying to do is get the same message through several different channels. So people are hearing the same recommendations and they know what to follow. So if they hear it again and again, they're more apt to follow those recommendations. People get really concerned when they actually hear conflicting messages. So one of the one of the key things about risk communication is consistency of message and repetitive and in message giving to the target audiences. So the next important thing is that you have to really identify and manage rumors or misinformation pretty quickly. No matter what, during any emergency, there's always going to be rumors. Some can be really harmful, where it really can have an adverse effect on a public health outcome. Those are things that could actually maybe they're recommendations for false medication, or they're telling people to take behavioral decisions that are not going to help them mitigate the disease and so on. And some are just really more reputational in nature, but nevertheless, it always happens. This is one true thing that happens during any emergency. And another area is that it's really important to develop easily understood materials in languages that your target audiences are using, and again, through the preferred channels of communication. Another really important thing is that when you're developing information and messages and material, it's really important to actually test those with the target audience and make sure that your intent, what you're intending to convey, that the target audience can actually act upon that. An important thing to do is just have them members of the target audience look at the piece of information or read it or hear it, and then ask them what they would do following exposure to this message. And if it's what you intended, then I think you're headed in the right direction. But it's important to look at terminology, make sure they understand that, and then can follow through on the action, that there are no barriers in place. So when we talk about risk communication, it's really truly a mix of media communication, other mass awareness initiatives, posters, pamphlets, other IEC materials. We're talking about social mobilization and being able to work directly with communities, at-risk communities, and get them involved in the decision-making process, a very people-centered approach. We also engage with partners and communities because, in public health, we can't always do it ourselves. We may not be the most trusted voice in the response field. So we really try to work with people that work with members of the target audience on a daily basis. We also, use typical, press things like press statements and public announcements. But what we're really going for is more of a two-way communication with affected populations. And, there are great options these days. Well, there's been great options for a while: hotlines, radio call-in shows, and really monitoring a responsive social media system. So what we want to do is hear regularly about the questions, the concerns, any misinformation that may be out there from members of the target audience, so that we can change the strategy of our communication and address those misunderstandings. So again, hotlines are a great way to do that because you can get frequently asked questions and you have a live person that can kind of feed back the proper responses. And of course, social media moves at such a rapid pace, we really do quickly get what rumors and misunderstandings are out there. Some other really good measures for two-way communication is talking to healthcare workers, because again, they're going to get the common questions that people have about the disease outbreak and so on. So it's important to develop that two-way communication now, so you understand where the population is coming from and what kind of information they may need to protect their health. It's important that risk communication is part of the health operations in the incident management system. It's important that risk communicators are sitting side by side with the other responders and epidemiologists that are talking about the disease. And so you hear more as a risk communicator about what the threats are, what the behaviors are like, and really understanding how we can better communicate about the particular disease, or in this case, a respiratory illness. It's important to develop a risk communication plan that has clear objectives and outcomes, and that really help define the resources that are required in order to carry through the risk communications plan to reach your target. It's important to have the staff, the tools, and the money to make sure that you can follow through on your risk communications plan to achieve your objectives. One of the other key things is communication coordination with different responders. If you're a Ministry of Health and you're dealing with a respiratory illness that maybe had an animal host, you really need to work closely with the Ministry of Agriculture or other responding ministries just to make sure that your approaches are similar and that you're trying to reach the same target audiences, or different ones that you're, more easily reach out with different communication mechanisms. But again, with consistent and frequent communication. That comes into play when you're doing rumor monitoring with key stakeholders and partners, because they may be hearing different questions and misinformation that you're not gathering, you're not able to gather from your perspective. And it's important, critically important, to have a fast-track mechanism where you can send out information really, really quickly. This isn't always so easy when there are a lot of unknowns, and it's not easy when you work in a technical organization where you're backed by scientific knowledge, and the scientists you're working with want to make sure they get the information right. That's really important, but it's also really important to get that information out quickly. And one way you can do it is making sure that you have just a few key people that can quickly clear information and get it out as quickly as possible to the affected population. Another important part is that you have a system in place where you can monitor social media and media for rumors and misinformation, and then counteract that with a change of communication strategy. Well, thank you. That's the end of this module. If you have any questions, feel free to send those to one of the email addresses listed on the screen here. And if you have more interest in coronaviruses, please feel free to visit the link also on the screen.